Hi, my name is Vicki Ralph, and I am an occupational therapist. I work for University of Colorado Hospital, and I also am an instructor with close training. I want to show you today how to measure for a compression thigh high and knee high. I think perhaps in the lower extremity, these are the most common forms of or common garments that people get. So let's take a look at how to do this and kind of take the fear out of doing this, because I think if you just follow a few simple tricks, I think you can get it done correctly and help save yourself the hassle of remakes and reorders and sending things back. So first off, what I like to do is when you look at the form, um, they will divide the measurements into length forms as well as circumference forms, columns. So, for example, here this one happens to be a form where on the right side I'm doing there's the lengths, and on the left side are more of the circumferences. With my patient here, her lymphedema is in the left leg. So first, what I want to do is just go on up the leg, and I'm going to make some marks in terms of where to put the lengths. And then I'll follow up those lengths, and then we'll follow up with the circumferences. So first off, let's have the patient dorsiflex, almost like they're standing. And I want you to take this, you put the bottom at the very bottom of the heel, and then you want to go up. Now, I often go to maybe the smaller part of the ankle. However, if you have a patient who has a larger leg that's coming down here, you want to take the measurement of that largest portion. And you can put it at this spot, but just take a look. So sometimes, those patients that have those cuffs, take a measurement of where that cuff is the widest. My patient here doesn't have a cuff, but when that cuff is bigger than at your ankle measurement, take that bigger measurement so that it doesn't cause an abrasive sore or wound here at the ankle. It would just be too tight if you did that. So first off, let's take and make some marks. I'm going to go at the bottom here, and it's kind of like I go right above the tibialis anterior right here. I'm just going to say this is 10. And honestly, for me, many times I find if I go in 10 centimeter increments, it often works well, and it often matches to where we need to measure. For example, I need to make my next measurement, which they call B1, at the base of the gastrocnemius muscle, and that is, for her, right at 20. Next, I want to go to the widest part of the calf, and for my patient, that's 30. Next, I want to go up. So if I was just doing knee highs, I like to go so that I'm at least 1 or 2 fingers below this crease here. So if you put one finger in the crease and the next finger below the crease, this is going to be where your D measurement is. So let's take a look. If I had this at 20, this is 30. This is actually going to be, if I follow up this line here, 41. So now I'm just going to take that and measure on the left. I'm going to put 10, 20 at the B1, 30 at the C, and 41 at the D. Oftentimes I find if I'm only going to do a knee high, in the comment section for me, and I'm sure the manufacturers have a better way of how they want us to verbalize it, but it seems to work for me when I'm measuring. I often will add 2 centimeters, and in the comment section I'll say lateral rise, so this was 41, at 43. So left slant lateral knee at 43. So I always add about 2 centimeters. And what that does is when you get a custom knee high, it angles so that the outer lateral part is sitting on the top of the fibula head. And it just anchors it. It seems to be more comfortable for patients as opposed to just going straight across. So that's just a tip that I use for knee highs, and it seems to work pretty well. But let's continue on. For the length, I like to go just at the, kind of right at the top of the, or right in the patella, right at the top of the patella here. And then I'm going to go mid, I just kind of eyeball it, mid thigh, kind of go to your widest part of the thigh. And the G at the length, I'm going to show you a little trick that we'll do to make sure that we get that one correct. But that one I like to do in standing. So now I want to take a look at how do we measure the circumferences. I'm going to show you how we measure the circumference of the A measurement with the patient standing, because we want to make sure that that's going to give the patient the best comfort, and when the patient is standing and putting some weight on it, it spreads out the foot a little bit, so I find I get a better measurement there. So I'm going to jump first off to the measurement that we call the Y measurement. The Y measurement is the one that diagonally cuts here. And it's critical to get this one correct, because if you don't have this Y measurement correct, it's going to cut in here, and oftentimes you're going to have patients complain that they have an abrasion or it's just too tight at the ankle. So let's move forward, and I'm going to, and also, so here I'm going to go forward here, and so see, this is called dorsiflex. I'm going to have my patient dorsiflex, and I'm going to pull this around from the heel, come all the way around, and you kind of just crisscross right above the tibialis anterior. If I come right down here, it might make it a little bit too tight, but I find if I just come up a little bit, and I don't know if you can see that measurement there on the camera, but it comes in at about 33. You can just see that that looks like that'll make a pretty nice, comfortable measurement, and the patient is dorsiflexed. So I'm going to write that down at 33 for the Y measurement on the left side. Next, we're going to do the B1 measurement, and that is going to be the smaller part of the ankle. I'm going to take this here. Again, I'm going to have you dorsiflex, and I'm just going to, this is a true loose measurement. Don't put any tightness on here, but just let your the measuring tape just fall. And here I come up with, I'll say 25.4. So that's my B measurement at 25.4. Now, this next one, this is what we call an anchor. This measurement and the next measurement help hold up the garment. So it's critical that we have to pull a little bit harder at these points. So first one, the B1, I'm going to take this and just give it some tension. And I do it 3 times just to kind of give me a sense. And each of the 3 times, the point when I start feeling resistance is the number I take. And on this patient, it's 30. So I go, if it's just a loose measurement, I would get 31.5. But you see, I'm giving tension, and I do it 3 times, and generally I always stop or I get this resistance at the same spot. And for this patient, it's 30. So I'm going to record for my B1 measurement 30. Next, I'm going to go to the C measurement. This is the one in the middle of the calf. And I'm going to take this, and I'm going to do the same thing where I go 3 times. 1, 2, just to see where my resistance is. And for this patient, I would say it's at 37.8. 37.8 for the C measurement. Next, I'm going to go to the D measurement. And again, this is more of a true anchor measurement. So I'm just going to hold it and get it so it's snug next to the skin, but I certainly am not going to give that resistance that I gave at the B1 or the C. So here I'm just going to put this on, and this pretty much sits comfortably at 38.1. So I'll record that, 38.1. Now, the E measurement is a little tricky because it's essential that you have your patient bend the knee. You see, if I went straight across and went right into that popliteal fossa area, straight across, I get the number 40, but it's going to be way too tight when the stocking comes in. So instead, I go up just above the kneecap here, and I'm actually going to capture not in the popliteal, but just go straight across just above that area. And this measurement is 42. That'll be a much more comfortable measurement for this patient as opposed to going directly with her leg rather straight. So this is going to be 42. Again, right now I'm above the patella and just above the popliteal fossa, going straight across. And I get a 42. Now we're moving on to the thigh. In the thigh, we have another anchor. One would think that the top of it is the anchor, but actually the F measurement is very, very important that we pull tightly here, because this is where we have to make sure that the stocking stays up. If we don't pull this one tight enough, you're going to see that it's falling down. The garment is going to start falling down. So here, I'm going to go around, and you can just straighten your leg. I'm going to go around the thigh, and I'm going to pull, and again, I'm going to do that 3-time thing, but I pull pretty hard. This, of all the measurements, is probably the one that I pull the hardest. And this comes up at 47, if I do it 3 times, 47.5. Now the G measurement I want to do in standing. The lengths of the G, the E, and the F I'm going to do in standing as well as the foot. So now we're going to have our patient stand up, and this is where we can get the rest of our measurements. So now we want to continue with the measuring of our thigh-high garment. And to do that, I want to get what we call the A, the circumference of A, as well as I want to get the lengths of the lateral and medial aspects of the foot. I've found to be helpful is I have my patient stand on a piece of paper, and I like to do it diagonally because I'll show you that in a moment. If I have to measure for both feet, I can do one foot this way diagonally, and then I have the patient stand the other way, and I can get both foot measurements on the piece of paper. Now, I have the patient put full weight bearing on here, and I'm just going to do an outline where I draw around her foot. So we're going all the way here, all the way around. There. Now, for the lengths, you would think, oh, just go to the base of the foot. But actually, when we are walking and when our foot is sliding and moving in the shoe, it's better to have that go up a little bit higher up on the toe than you would imagine. So rather, you don't want to just go to the base of or at the metatarsal head, rather go up on kind of mid-joint of the big toe here. And I just find that you'll get a much better fit. So I usually just on the paper do something like that. However, for the little toe, I find if it impedes or it goes up on the little toe, my patients complain about that a lot, and it sometimes causes an irritation on that side of the foot. So here I like to just go at the base of the little toe, right over there. And then we're going to measure these medial and lateral lengths a little bit later, and I'll show you how when we do that. But right now, let's take a look at how to measure for the A measurement for a thigh high. Now this is a little bit different from when we measure for the toe cap. In a moment, I'll be showing you how to do the toe cap. But right now, I want you to see how we're going to go kind of a diagonal measurement over the metatarsal heads. So I'm going to have my patient lift her toes up. And I want to get right under and then step down. And I want to get under here, and you can see she's in standing, And this measurement here, I'm giving some tension, but not full tension, but giving some tension, and that's 22.5. So just to help me remember, I'll put 22.5, and I'll record that later when on my form. But that measurement is the 22.5. Next, I'm going to take this piece out because it is a little bit elevated, and I want to get the lengths of my patient. Now, we did the lengths all the way up to the D measurement, but now I want to take a look from the floor to the E, to the F, and to the G. Some of the manufacturers are different in how they measure with this. I've found with the Elmerex or the Jopes, once I go a straight line, so if I put the 0 at the base of the floor and I come up to the marker that I put here on the top of her patella, in standing now, that number comes to 48. So I'm going to put that down on our listing as 48 for the length of E. Now, if you're using a Medi garment, we want to do the same thing, and let's just see if we get the same measurements or not. We're going to follow the contours of the leg. So here, rather than going straight up, I'm going to follow the contours. So remember my previous one at 20, I think I made the measurements right, is that like 23 here. So you just kind of inch your way all the way up, following the contours. And you see for a Medi garment, this measurement would be at about 50.5. So sometimes if you measure for one garment using the same methods that you would use for Elmerex versus Medi, you might find that one garment comes up a little bit shorter than it should. So just know that with Medi, you're going to follow the contours. And with Elmerex, if you're measuring for a Jopes Elmerex, you're just going to go straight up. You'll take that measurement and go straight up to what that number is. So again, we're going back to Elmerex, my number was 48. And if I want to go straight up, my next measurement, holding it at 0 at the floor, would be 66 for the F measurement. Now, G is a little bit tricky because the front of the leg is usually longer than the back of the leg. So I often find if I just kind of do a happy medium, if I take a measurement from the floor to the base of the gluteal fold, as well as from the floor to the perineum or to the top of the thigh, and I take an average of those, that measurement tends to work out pretty well for your G measurement. So let's see what happens with our patient here. So I'm going to put the 0 down here. I'm going to go all the way up. I'm going to just move your jeans up a little bit here. So this number here I'm getting is, I'll say 82.5 on the front. And then if we go around here to the back, I want to go right up to the gluteal fold here. So I put the 0 on the floor and go all the way up to the base of the gluteal fold, right at the bottom of the butt. That number is 78. So if we have 78 in the back and 83 in the front, we have a 5 centimeter difference between the back and the front, and that's pretty normal, especially with women. So what we want to take a look at is we'll just take an average. So I'm going to make her length 80.5, and I find that usually works out pretty well. You see I added 83 in the front, 78 in the back, 5 centimeter difference. Let's add 2.5 to the 78. So it gives us a number of 80.5. Now, if we were going to do the length for the Medi, we could do the same thing. Remember for the Jopes one, we went straight up. But with the Medi, we're going to go up here, I'm gonna put the 0 on the bottom. I'm gonna get my measurement here. Yeah, that's good. That'll be better. So here we'll go 10. And I'm just going to keep going up her leg to get my measurements. And it'll be really interesting. Now she doesn't have a lot of lobules, but you can see if you had more of a lobule or a rounder leg, this could make a difference in the measurements of your thigh high. But here she comes up pretty straightforward with, if I'm coming up front here, I could go up to 83 here. And let's go on the back. Again, with the Medi, you just want to follow the contours of the leg to get that measurement. So here I'm just going to go from the bottom on the needle side and go on up. Let's see, here we're going to go down here. And I just kind of inchworm my way up. Now this is interesting because remember how before with the other measurement I got 78. Here as I inchworm up, I get 81 when I go to the gluteal fold by following the contours of her leg. And that's why you need to take a look at what measurements you're making and what company you're working for or measuring for. Just remember with, kind of a, this is like making it as simple as possible. With Medi, follow the contours inchway, kind of be an inchworm as you're measuring all the way up. And with Elverex, you can go the straight line. And that will hopefully give you the correct length that you're looking for with the garment that you're measuring.